everyone. Mental health is something we all talk about, but do we really understand it? I'm Sangeeta Rathod, your Joy of Wellness convener, and today, on the occasion of World Mental Health Day, we are lucky to have Dr. Nirav Mehta with us, who is leading psychiatrist with 25 years of experience. He will help us clear myths, share tips, and guide on taking care of us. Welcome, Dr. Nirav. We are so glad to have you with us.
Thank you for inviting me for this noble cause.
Doctor, 10 years ago, we are barely spoke about cognitive or mental health. But now it's everywhere in school, workplaces, and even at home. Can you tell us, Doctor, what is the reason that mental health issues are becoming more common or more visible across all age group today?
Okay, so when I talk about mental health, when I started my practice in 2003, people used to not come to our clinic. Now the question is that people are coming, seeing the Google and reviews and the testimonials. So what has happened? This digital era has expanded the reach of the mental health illnesses and their treatments to variety of organizations and variety of subjects. One more thing, the availability of good medications have caused the treatments to be okay, and now there are lesser side effects of the treatments. One more thing, that there are many people who are now coming out with the motto of delivering themselves as telling themselves as mental health patients, so that if they accept, then there is a large group of people following them, and these people follow them as role model, and they become the patients, and they take treatment for the illness.
Many young families still have misconceptions about mental health. What are some all of the most common myths you think need to be cleared up?
Okay. So when we talk about approaching how to access mental health, before that, I would just like to clarify that the people, there is still a stigma in this age also. There is still a stigma about the mental illness, that people are telling that mental illnesses are a taboo. But now the thing is that many people are going into education and learning psychology and psychiatry, and more of the people are coming out of the misconceptions. The most common myths which I would like to enlist is: first is, psychiatric illnesses are not real illnesses. First is, they are something functional. So functional means, there is no organ in the body where there is no illness. But actually, what we see, that mental illnesses are all bona fide brain disease. See, if we think, when we think about something, when we have emotions, when we have joy, when we have sorrow, those all feelings come in our mind, and mind is the where the brain is there. So neurons are mainly related to electrical activity, but in the better way we can say that emotions and mind both are related to electrical activity. In that process, another myth may be that if the patient has a mental illness, he is never going to be okay. Third myth may be that if the patient has a mental illness, then he is very violent. It is not a question. Every mental illness patient is a suicidal patient. That is also not a myth. That is also a myth. Uh, all psychiatric medications are dependence producing. That is also a myth. If you take the medications under the supervision of a psychiatrist, qualified psychiatrist, then there are no worries about, you should not have to worry about the problems. So what I feel, the concepts, myths and conceptions are there, and they are going to be there in and out, but we should be always going for, we should always be fighting against those myths and concepts, stigmas, so that we can change the future.
Doctor, you have just talked about the misconceptions and the stigma for the mental health. But can you tell me how can they recognize it's time to seek professional help? And what are some simple, approachable ways to access that help without feeling overwhelmed?
Okay. Very nice question, ma'am. I would like to tell this to people that whenever the patients are having bad mood, a sad mood, a anxious mood, a fearful mood, a suspicious mood, a joyful mood, which is more than normal, when there are changes in sleep patterns, when there are changes in eating patterns, when there are changes in functioning patterns, when there are changes in emotional patterns, ultimately, that patients may feel guilty about the same thing. And the guilt is the most important uh, factor we should take in mind when we are talking about mental health, because guilt, when it comes, it may kill the patient, because whenever there is a guilt about the illness, or the patient has done something wrong, then the patient may try to commit suicide. So when we talk about suicide, patients say that no, we should not be talking about suicide, but unless and until we talk about suicide, they are not going to be, we are not able, we will not never be able to uh, decrease the rate of suicide. When to seek the professional help? Any day, when you feel that you are down, you are changing mental health emotions, then you can just approach any psychiatric help or psychological help.
So nowadays people take medicines even for very mild illnesses. So we see that can over dependence on medication have any long term effects on our mental health?
I would like to give the answer in this matter. That suppose if you have malaria, so we will take, it is a physical disease, it is a bodily disorder. Okay, so we will take a course of 3 to 4 days, and we readily accept that thing, that we need that medication. Uh, when we talk about mental health issues, we can just think about some short-term issues and long-term issues. So people may have some short-term issues where they are not applying themselves and they are falling prey to the illness. So during that time there is a crisis. So if the crisis is there, and no doubt the duration will be less, but the crisis is severe. Suppose the patient is suicidal, then we cannot deny that patient should not be taking medications. But if the duration is less and if the symptoms are less, then we can say that okay, just uh, try with the coping skills so that you can cope with the situation and you can just come out. But the dependence and all the things what we see are just we have to follow the psychiatrist or the psychologist and follow them so that they can guide better.
So we know poor eating habits and junk food harm physical health. But how strong is the connection between gut health and the mental health?
It is a very good question. See, in the past, before centuries, we didn't have any medications. So whatever we used to cure ourselves, that was our food only. You might be knowing that majority of the females go for mango season, and mangoes are loved by almost all people. Now mangoes have tyrosine in them. Tyrosine is an amino acid, so that is converted into 5-hydroxytyrosine, and that 5-HT is serotonin. Now, what I am trying to tell you that 5-HT is a chemical formula of serotonin. So, it is converted into the 5-hydroxytryptamine or 5-hydroxytryptophan in the body, and the raw form of serotonin is the mango and the tyrosine. So what I wish to tell that our food habits have a major role on the gut flora and gut bacterial flora. Whenever there is a, as you might have seen about irritable bowel syndrome, that people are having diarrhea when there is stress. So whenever the stress is there, patients have diarrhea. Whenever the stress is there, patients have excess urination. So what I want to tell that both the physical health and the mental health, they both are coincidentally increasing and decreasing by each other. It is a seesaw effect. Okay, so if the gut flora will be gut bacteria will be there. One more thing I would like to explain to you, that serotonin is carried to the brain via the platelets. The blood cells are of three types: red blood cells, white blood cells, and the platelets. तो रेड ब्लड सेल्स जो है वो अपना हीमोग्लोबिन एंड ऑक्सीजन ले जाते हैं. द white blood cells, they are the immunity, and the platelets, they have the main important function of carrying serotonin from the blood to the brain. So, and the clotting. So vomiting, whenever you suppose you are vomiting, so vomiting is also a side effect of increased serotonin. So I would like to tell that all they are intervened, the brain and mind. We cannot see as different entities.
Doctor, stress seems to come in different forms at every age. At 15 to 25, study stress is there. At the age of 25 to 35, family or marriage stress is there. At the age of 35 to 45, the business or the career stress. And the 45 plus, there is a retirement stress and the loneliness. So, is there such a thing, there's a good stress, or how can we turn stress into some positives instead of harmful?
Okay, so at each and every juncture of life, when we talk about teens, when we talk about adolescence, when we talk about adult age and elder people, everywhere, at every point, there is something known as a U stress, EU stress. So what is U stress? That is a normal stress. If there is no stress in life, then you will not function properly. So some amount of stress is required, and that optimal amount of stress is related to the patient's own capacity. And suppose the patient has a threshold is less, then we have to say that the patients will be easily they will have deteriorated mental health. So what I want to convey that the more we talk about the mental illnesses, the stress factor are more coming in our mind.
Women are often more sensitive and emotionally connected to their families. After 45 to 50, when children grow up and start their journey, many women feel a sense of emptiness or loneliness. So, Dr. Mehta, what positive steps can our ladies take to stay happy, engaged, and emotionally healthy during the beautiful new phase of life?
Very nice question. See, during this phase, when there is a midlife crisis and the children are on their way of learning and doing jobs, so we cannot tell them no, but we can tell yes to ourselves. What we can tell, yes, we can go outside, we can do something else. When there is physical deformity or disability, then we should take help of the other people. so that we can be out of the situation. Loneliness can be created or healed only by the way of filling in the blanks. What I feel, that we have to be social. See, there is one more term, altruism. Altruism means social service. I will like to tell you that many people or old age people, they go into social service so that they get good remuneration also and get emotional feedback also. So that is needed, that the patients, when the females, when they are into in their prime age, they should be going for social service also and social causes also. So most of the NGOs, what I've seen, they are run by old people who are females also, and that is the reason why we have the organizations which help the children and the old aged people.
Doctor, I recently read Dr. Joe Dispenza's book, You Are the Placebo, where he claims that visualization help him heal and regrowth his spine. So, how effective is visualization? Is it as a tool for mental and even physical health?
Okay, so I will just simplify this story, that he is that person where he was having some injury, and he has destroyed his spine. So he was not able to, he was quadriplegic, and he was not able to walk even, and even move the limbs also. So what the power of visualization means, what is the power of it, is power of manifestation. What I feel, that what we think in our mind can be proved and it can be done. So the positivity comes from within. So if I am positive from within, I will be positive outside also. So whatever the world is within me, I will see the world outside. So I am just telling you that whenever the person has this kind of problems, they should be visualizing, or they should be imaging the things, that whatever they want to do. And if they do their thing, it is possible that they regain their previous role.
How does open and honest communication within a family or relationship impact mental health? And what simple steps can families take to create a safe space where everyone feels heard and supported?
Okay, so the best way, the most near people, what you are having, there is an inner circle. So whenever you talk about family, the family may father, mother, grandfather, grandmother. If there is if a joint family is there, then they are the people who are living with you for years. So there are chances for them to better understand you. There are instances I have seen that the old aged people or the parents don't understand the people, but you should be clarifying them the situations, so that in future, whenever there is a problem, they can be with you. One more thing that I will tell, that the, the situations which are there, uh, we want to solve, then we are not capable of solving all the situations. We can take the help of people, and those people are our families, friends, and near ones. So the importance of the family lies here.
Can you tell me, after the age of 40, what changes can affect both physical and mental health?
So when you talk about this age group, there are hormonal changes which are there in the body. There are circadian rhythm changes, like sleep changes are there. So people are more into the mobile screens because they don't get sleep. Their sleep cycle is reduced. So what need to be addressed is mobile screen time. Then third is diet changes, that they cannot eat more food, and they take less food, and that reduces the immunity. And what I want to convey to them, that there should be there are dietary changes, and there is a sedentary lifestyle which is making them bound to the home. So if there is these are the causes which lead to the mental suffering and emotional suffering, and ultimately physical suffering to the body patient.
I totally agree, doctor. Screen time affects sleeping cycle also. So, what preventive care or lifestyle changes should we adopt to stay mentally fit during this stage of life? And also, could you please share some simple games, leisure activities, or hobbies that can keep the mind active, reduce stress, and bring more joy to everyday life to maintain good mental health and emotional balance during this phase of life?
And this is the most important topic which I would like to cover. See, there are hormonal changes, so we can just simple answer is that we can go for hormone replacement. Either they are natural, or even they are chemical in nature, or hormone replacement therapies are there. If you want to talk about sleep, we can go for there is a guided sleep techniques are there, and there is maintenance of sleep hygiene. Moreover, what we can use, the most important is melatonin. Melatonin is that chemical which is naturally produced in the body, and that is given in the form of tablets, or they are fizzy tablets. So they are not detrimental to the patient, they are not harmful for the patient, and they initiate the sleep cycle. So whenever the patient, female or male, has sleep problems, they should be taking melatonin, not the benzodiazepines. What I feel about the screen time, that the answer to decrease the screen time is to say no. वो आपको ना बोलना ही पड़ेगा. You have to say no. If you don't say no, then you cannot decrease the screen time. So gradually you can do something like that. We say, do the screen time for 10 minutes, then 5 minutes, and even in that way. Moreover, we can increase our extracurricular activities like playing games outside, and in the night time we can have home games like caroms. Then we can use ludo. Even there are games in the mobile also, which can be their concentration games, so that can be used as a remedy for sleep. One more thing, what I wish to tell you, that you do that thing that doesn't give you joy. Suppose if it creates interest in your mind, then you will not be able to sleep. So suppose if you want to sleep, sometimes you have to be distracted by a negative or a less interesting thing, so that suppose I will tell that any religious book, I am not a religious person, so a religious book, suppose I read, I will surely go to sleep. So I wish to tell that people should be doing less interesting things, so that they can go to sleep easily. And unless and until they don't get sleep, they should not be going on the bed. They should be sitting wherever they are sitting there. Once they are drowsy, then they could go to sleep. Moreover, the sedentary lifestyle, what I'm trying to tell is the sedentary lifestyle should be changing, and there are aches and pains in the body. The body is not as young as previously thought about. But what I feel, that there are some floor exercises which can be done on the floor. Then there are some swimming is there, which is very good for the body, and some light games like table tennis is there, then are there. So these games, which are indoor games, can be helped, and which can be adopted by the people, just to avoid being not a sedentary lifestyle.
Thank you, Nirav Bhai, for your insight, time, and wisdom.
Thank you for inviting me for this noble work and the gesture which you have done for the society, and hope this work continues and it enables more depressed patients, more psychiatric patients, their full work pattern.
So, friends, let's make mental health a priority, not just today, but every day. Reach out, talk, support each other, and remember, you are never alone. Thank you.